Dr. Furman has requested a meeting with Mrs. Hamilton, her daughter Tammy, and Lily Grace, the community health navigator, for the purpose of sharing the findings from Mrs. Hamilton's evaluation for her confusion and forgetfulness.
Well, Ms. Hamilton, thank you for coming today, and I appreciate you bringing your daughter here because I know we wanted to go over the results of your testing that you had for your memory loss. And I did invite our community health navigator to be here, so because she's going to offer some resources. Do you want to just introduce yourself?
Sure. I'm Lily Grace, and as Dr. Furman said, I'm going to be helping connect you to resources in the community, whatever you might need as we work together.
So that's good.
I'm her daughter, Tammy.
Nice to meet you.
Great.
I'm Mary.
Well, thank you all for coming. And Ms. Hamilton, can you just tell me what you know about why we ran these tests, just to make sure we're all on the same page? And
Well, I guess it's because, maybe I'm seeming a little forgetful lately, and Tammy brought me in to have these tests done. And so I said I would do them for her. But, all older people get forgetful at times, don't they?
Well, yes, and sometimes, sometimes there's this like normal forgetfulness, and sometimes it's a little bit more than just normal. And so that's why we wanted to do this workup and figure out what was going on with you exactly. So, and thank you for taking her to all these tests. And so I wanted to go over all the results and kind of tell you what's going on. But first, I just want to say I'm afraid I'm going to be giving you some bad news, and I'm sorry to say that because I know it's not what you want to hear. Putting it all together, I think you have Alzheimer's dementia. And I know that's scary and it's hard to hear that. But the reason I say that is because, we did the blood work and it didn't show any reversible causes. We did the imaging of your brain and it did not show anything that we could fix, like a big mass or blood in the brain. It showed a little bit of shrinkage of your brain, but we see that a lot in people that have Alzheimer's dementia. We did a physical exam, we did the history, we did the whole thing trying to figure out what was reversible, and we couldn't find anything reversible. So the most common form of memory loss that you have is Alzheimer's. We actually did the neuropsych testing. I don't know if you remember, like the 2 hours, a lot of paper and pencil back and forth testing, and that's more specific to try to figure out exactly what type of dementia, and that's what came back showing Alzheimer's dementia also.
It's okay, Mom. At least we know that we have a diagnosis and we know what it is.
They asked a lot of questions.
Yeah. Did you have any sense that it might be this, or you just kind of were thinking it was more normal?
I was hoping it would be more normal,
Yeah.
but maybe in the back of my mind.
And sometimes it's it's best to have an actual diagnosis because now we can figure out where to go from here, and there are things that we can do to help.
Is there anything we can do at home, or?
Well, I think definitely you want to stay active, you want to stay engaged, and keep doing the things that you're doing, and we want to keep you as functional and keep you as good as you can be for as long as you can be. You're on Aricept now. It's also called donepezil. Your other doctor put you on it.
Yeah, you're on that.
And that's a good medicine for dementia, and so I definitely keep you on that. And I'd like to have you come back and we can kind of go over some more of the details and bring all your medicines. But in the meantime, I wanted you to talk to our community health navigator because she has some good resources to help with what you can do at home.
Yeah, the Alzheimer's Association actually has a lot of great information on dementia. They put together this packet that has some good resources, and you all can take that home and read through it and let me know if you have any questions. I also want to get you in touch with the Adult Day Center in your area. That'll help to get you out of the house and keep your brain active. You can go there to meet people and have a meal. They serve lunch every day, and I want to get you in touch with an elder law attorney. He can help with advanced care planning as well as answer any financial questions you might have because this can be a very confusing time. And then I just want to be a resource for you all during this journey. I wanted to do a home visit and meet with you all individually if that would be okay. Do you think we can do that?
I live over by the Pick Pack.
Okay.
That's good.
Yeah, I would really appreciate it if you could come over.
Tammy wants me to move in with her, but I hope I could still live on my own. I think I could do it okay.
Well, that's what we're going to talk about a little bit more the next time, and I think doing the home visit will help us assess that and figure that out, because we want what you want. We want you to be as healthy as you can be for as long as you can be.
Okay.
But do you have any more questions about the diagnosis right now that we could answer?
No.
I think what we'll do is schedule a follow-up in a week or two and just write down questions, because once you get home, I know there'll be a lot of people asking you questions that you can't answer, and you can bring anybody you want to next time, and we'll just kind of go from there.
Tammy.
Bring Tam, yeah.
Just me and Mom.
Well, thank you for being here. I appreciate it, and I appreciate your
Dr.
time.
Fran.
Yeah,
Thank
and
you
we'll
for
just
your
kinda
help.
Thank you for coming.
Lily Grace.
Yeah.
Thank you.
Thank you.
At the Free Legal Clinic, Joe Torres, a law student being supervised by a practicing elder law attorney, has met with Mrs. Hamilton, who wants to be called Ms. Mary, and verified her ability to make her own legal decisions. In this scene, Joe, Ms. Mary, and Tammy discuss these decisions and the related legal documentation.
Well, Miss Mary, thanks so much for coming in, and Tammy, thanks for bringing your mom. You've told me a little bit about your current situation with your family, that your husband passed away, and that you have a son that's now in prison, and Tammy's basically your main caregiver.
That's
And
right.
one of the first forms that we fill out is a will. And your will is your directive to the world saying how you want your assets to be divided. So typically when people have children, they give equal shares to both the son and the daughter. Is that the way you want your assets to be divided?
I don't think so, not anymore. I mean, I gave some money to Milton, and Tammy takes care of me now, and I want her to have the rest of it.
Okay, so she'll get the painting and the jewelry and whatever's in the
Whatever's
bank
there.
accounts. All right.
Milton's been calling her for years on the phone asking for money.
Well, I don't
Taking advantage
give
of
him.
her.
I don't give him the money.
That's something I think
Most
later
of the
on we'll
time.
have to talk about.
Okay.
Maybe develop some safeguards so Miss Mary doesn't get hurt in any way.
Yeah.
So do you also want Tammy to be the executor of your estate? That means that she would be the one to take the will to court and probate the will.
Oh, I guess so.
Probate.
So probate is a system at court, and with your estate, we probably could bypass going to court. It would just be a matter of filing some forms.
Oh, sure. Then she
Yeah.
would be the
But
person.
we still need an executor.
Now she would be in charge of things like if I had to go into the hospital and I'm not feeling really well, and she would have that.
Okay,
that
so we're
say
gonna,
so, right?
Yes, we're going to talk about that next, because these forms are
Okay.
quite confusing, but there are a number of forms that we have to fill out.
Oh,
So we just
okay.
talked about the will. Now let's talk about the durable power of attorney. So the
Okay.
power of attorney appoints someone to handle all of your finances or do your business transactions.
Okay, that's Tammy.
From what I'm hearing, it's going to be Tammy. Yes, it's called a durable power of attorney because the power of attorney is in effect up until the day you die. So if you're incompetent and you can't make any decisions, that power of attorney still remains in effect. But the minute you pass on, the power of attorney ends.
Okay. Well, she writes the checks for me now, and she has that power, I guess. She
I go to
does
the bank
that
for her all the time.
because I
Okay,
don't
great.
feel well most of the time.
Yes, I'm sorry. And
Yeah.
Tammy, are you on the bank account?
I don't know if I'm on the bank account. She gives me her checks. I go to the bank, and she has a username and password that I use on her online, but I don't know
Okay.
if my name's actually on the account.
So after we sign the power of attorney, you'll have to take that to the bank and
Okay.
then let them know that you're the power of attorney.
Okay.
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 The power of attorney has nothing to do with health care. Now, you mentioned to me that you didn't want to be put on any life support.
Oh, heck no. No. I don't want to have that done. I mean, I don't want to be a vegetable planted in some nursing home.
I
And,
understand.
I can't see anybody or know anybody. And if that happens, I want to make sure that it's written down somewhere. They don't do that.
Okay, alrighty. So there's two forms that I want to talk to you about. One is called the living will and one is called the healthcare surrogate.
Okay.
So the living will is your directive that life-sustaining procedures should not take place if you're in a terminal condition, and that means that you have no cognition, you're not able to make any decisions.
Okay.
And from it sounds like that's what you wanted.
That's right.
Okay.
Right. If I can't think or I'm just not well, I'm not all here, you know, that Tammy would be able to make those decisions for me.
Okay. But would you want to be able to be hooked up to feeding? So if you're in a terminal condition, you can't make any decisions. They could nowadays keep your body alive. Would you want a feeding
Oh
tube?
no, no, I don't want that.
What about antibiotics or pain medicine
They could do
to
that.
prolong your life? Yeah, they could.
Maybe no to the antibiotics, but for pain, I really don't want to be in any kind of pain.
Okay, we could put that into the form.
If they can do that, that would be good.
Okay, all right. So that would be the living will. But there's another form called a healthcare surrogate, and that's where you actually appoint Tammy, in this case, to be your surrogate to the world, to tell the doctors and the nurses all of the healthcare decisions that you would want, because you've had this conversation
Okay.
here with me
And
today
you could do that.
and with each other.
Okay.
I want to do that for you, Mom.
Okay.
I do. Okay.
Within that form, you'll have to also check a little box, and we'll go over these forms as I told you again. You have to check a little box that says you don't want life-sustaining provisions taken.
Okay.
Okay, all right, good. Well, there's one other form that I want to talk about, and that's the medical order for scope of treatment form, which is a new form that's actually signed by your doctor.
Oh, well, you have a doctor's appointment next week.
Do I?
On Monday. Do you have the form, or would the doctor have the
The
form?
doctor has the form, but
Okay.
I'll give you a copy of it too.
Okay.
Yes, it's a form that you actually, you'll talk to your doctor. You'll have basically the same conversation with your doctor. And then the doctor will sign the form with you, you'll sign it, and then he'll give you copies of, or she'll give you copies of the form, and then you'll
Okay.
take that form and you'll put it on your refrigerator, a copy of it, and you'll put it on your nightstand, so that if anything happens at home and EMS were to come to the house, they would know that you've already signed the most form.
Oh.
They know to look for it?
They know to look for it now.
Oh.
Yes, yes, yes.
Okay.
EMS does have a DNR, and we could talk about that later, whether you'd
Okay.
want to sign it, but the most form is actually going to take the place of the DNR. Eventually, they're going to have it in their computers, and EMS is going to tie in with all of your doctor's records at some point in time.
Okay, I hope so, because this is an awful lot of paperwork, just,
It's a
just to
lot,
be
I know,
dying.
I know.
I mean, this is just, I don't know, there's so many initials.
I know, a lot of initials, a lot of signing. But
Yeah.
the good thing is that you're doing this while you still have cognition, while you know what you're doing. And Tammy, it's real
And
important
Tammy's
for you to
here.
have this conversation with your mom, so that
Yeah.
you know what she wants.
I've tried to talk to her about it before, and she really wouldn't talk to me about it.
Well, she wants me to come live with her. But I mean, I love Tammy. She's been so good to me.
Yes.
But you know what? I think I could live on my own.
Okay, all right. Well, with these forms, maybe it'll help, and then you all can talk about that. So let me go in the back, and I'll have the staff start preparing the forms, and then we'll come back in about 20 minutes. Is that okay?
Yeah. Is there somewhere we can sit?
Sure,
Okay.
absolutely. Yeah, there's
Okay.
coffee in the little break room over there.
Okay.
It was great meeting you, Ms. Mary
Okay,
and
it
Tammy.
was-
Thank you.
It was really nice to meet you
good,
too.
Good to meet you too. Thank you.
In this scene, Ms. Mary and Tammy are meeting with Lily Grace, the Community Health Navigator, to discuss community resources.
Thank you all for meeting with me today. I know last time when we met, we talked about maybe discussing some more options for services available to you all out here, like the senior center and maybe some transportation too. I thought that today, while we were together, we could give a call to the Aging and Disability Resource Center at KIPTA. They can screen Miss Mary and get us in touch with some more services. Would that be okay?
It's okay with me. Mom, is that okay with you? We're going to call KIPTA.
Okay.
It's an agency that can help us.
Okay,
Yeah.
yes.
Jenny, the Aging and Disability Resource Center specialist from the Area Agency on Aging, completes the intake assessment. We rejoin them at the conclusion of that assessment.
Thanks for taking the time to answer all of my questions. They are very informative and helpful in helping me understand how the Area Agency on Aging might be able to help you. Based on the information you have shared about your current level of independence and resources, I believe we'll be able to set you up for transportation support for a local van service. Do you think that would be helpful?
I think that would be very helpful. I was curious though about meals. Is there any kind of service that you can help us with? Because I'm having to go to work and Mom's at home and she's not eating when I'm not here.
Yeah,
and that
yeah.
concerns me.
So I know I've mentioned this before, but we can give you some more information about the senior center here in
Okay.
Henry County. Miss Mary can go there during the day, and they provide socialization and as well as a midday meal. So that'll get her a chance to get out in the community and also get her lunch, so you don't have to worry about that.
Okay, I'd be very interested. How does that, Mom? How does that sound? We're talking about going to a day center to get meals
For lunch?
for lunch. Uh-huh.
Sounds good.
And you can get out of the house.
Okay.
Okay.
Does that sound good, Jenny? We're going to set her up with the senior center.
Yes, Henry County does have a great senior center. If you find these options helpful, I'll proceed with getting things set up for her. I'll place Ms. Mary's information in our computer system, and based on today's screening, you'll be given like a priority score for in-home services, like homemaking and case management. Your CARE score puts you on the waiting list, however, but if your situation changes, you should just call back and let the ADRC know. And the staff at that time will be able to do a screening and update your information in the system on the waiting list.
Okay, that sounds great. Thank you so much for everything, Jenny, and we'll be back in touch if anything changes on our end.
3 years have passed and Mary's Alzheimer's disease has progressed to moderate stage. Mary has been discharged home after being hospitalized for injuries from a fall. Lily Grace contacts the AAA to request an assessment for emergency home services. In this scene, Kara, the social worker, who does the ADRC in-home assessments, is completing her evaluation of Ms. Mary and her caregiver, Tammy.
Ms. Martin, there's 2 more things that I needed to go over before completing the assessment. I noticed your mom rubbing her face and clenching her jaw. Has she been complaining about pain in or around her mouth?
No, but I did notice, because for some reason she's not brushing her teeth anymore, and I don't know if she's being stubborn or what's going on, but I did notice last night I was trying to help her brush her teeth, and every time I brushed on that side, she would like bite down on the toothbrush. So
Okay.
I don't know, something's bothering her, maybe her tooth or something. I don't know.
Has her eating habits changed any?
Not really. No. I feel horrible because I don't know the last time she went to a dentist.
Okay. I can't be certain, but it sounds like she may have a toothache.
Yeah.
So does she have a dentist?
I knew you were going to ask me that. I think the last time she went to the dentist, it was like a dental clinic somebody set up out in the county here. We don't have dental insurance. And, every time I've gone to the dentist on my own, and every time it's really expensive. I mean, it's like we don't have the money to go. I feel horrible. I mean, she needs help.
Okay.
Is there something you can help us with? I mean, I feel horrible. Like, I should have taken her to the dentist, but we don't have the money.
Okay. Well, don't feel bad about
Yeah.
it, because you wouldn't know. I mean, because she may not be able to explain to
Yeah.
you the pain that she's having in regards to with her tooth.
Yeah.
So I can do a referral for a dentist, and also getting her transportation to that dental office as well. If it's okay, can I complete a caregiver assessment with you?
Sure.
Okay. And also, this will actually help out with other potential resources that may be
Okay.
available to you as well.
Yeah, I guess you can see I'm really stressed out. I'm really stressed out. You okay, Mom? It's okay. You can keep sleeping.
When's the last time that you've been out to any socialization activities or anything like that?
I mean, when? Like a year ago, maybe? I don't know. I mean, all I do is work, and then I try to take care of her. I think maybe it was a year ago that I used to meet up with friends on Thursday and we'd play cards, but I haven't done that in a long time. I don't have time.
Okay. What are your fears or concerns? In
Well,
regards to
obviously,
that?
look at her. She can't be left alone. Frankly, I don't know what she's going to do if I leave her alone. Sometimes she wanders, and she's wandered out of her apartment, and I can't leave her alone.
Okay.
So I think I'm going to lose my job because I'm having to stay home with her. I mean, I need help.
Okay.
I really need help.
Yeah. Well, your fears are understandable, and as a team, we are here to help you.
Okay.
What about your mood?
I've been really sad lately. I'm sorry. Sometimes I just start crying because I'm just so overwhelmed.
Okay.
So I would describe my mood as sad.
Okay. And this one, this assessment is going into talking about within the past month what concerns you've had. Have you been feeling sadness or feeling down in the dump, or?
I feel really sad because I don't know. I have to support myself. I have to give my mom money because she needs money, and I have to work, but I can't be in two places at once. And then not to mention my own children. I mean, it's just too much.
Okay.
I feel very overwhelmed.
Okay. Do you feel that sometimes you're easily annoyed?
Yes, and I feel like I'm getting annoyed with my mom. Like I'm irritated with her. I'm irritated with my kids. Yeah.
Okay. Do you feel abandoned or alone in the situation?
I mean, yeah. Where's my brother? I mean, he's no good. He doesn't help. There's nobody in our family. Not even extended family. Nobody comes around to help me. So yeah, I'm abandoned.
Okay. What about crying a lot? Do you feel that you're?
I try not to cry in front of her. But yeah, I'm crying. I go in my room and I cry. I try not to let my kids see me cry. I don't know.
Okay.
It's a lot.
And do you feel that there's a lack of initiative on other people in regards to helping you as well?
Yes, absolutely. There's
Okay.
no help.
Okay. I know that this has been a lot of questions, and I just want to thank you for your patience in regards to taking the time to answer all of those questions. And based on the information that you have given to me, it sounds like that she would be eligible for in-home services and emergency services
That's so
for
good to hear.
that.
Thank you. So good.
So I'll be back in touch with you in regards to the next steps.
Okay.
In regards to that.
Thank you so much.
Yeah.
Thank you. Bye-bye.
Thank you.
At the free dental clinic, Dr. Hill has completed her dental assessment and discusses her plan with Tammy and Ms. Mary.
Ms. Hamilton, thank you for letting me have a look in your mouth. I know that you're uncomfortable today, and I know that this is awfully hard, but thank you for letting me look a little bit.
Will you help me? Help me.
Is it okay if I talk to your daughter now?
Tammy?
Tammy? Yes, can I talk to Tammy
Is
now?
Tammy here?
I'm right here, Mom.
Tammy's here.
I'm right behind you, okay? I'm right here.
Can I talk about your pain with Tammy in your mouth? Okay, thank you. Tammy, it looks like we've got some real problems here. You know she's uncomfortable. That she's having
I'm
trouble.
really feeling horrible
That's
about
it.
this.
Thank you, Miss Mary. You're doing good.
Yeah, I feel horrible. I'm going to admit she's not been to the dentist, and I'm going to say it's at least 3 years, maybe 4.
That's when I was able to look in there, and it was a little bit tricky because she didn't want me to look in. But I can see that she has a couple of teeth that are really broken, and they have big cavities in them, and they're really sharp. And the swelling that she has, I think it's caused by those 2 teeth. When we looked at that big X-ray that we took, it looked to me like those were the teeth that are involved. And Miss Mary, I know you're uncomfortable. We're going to try to help you.
Will you help me?
Yeah, we will help you.
okay,
We'll
Mom.
make this better.
It's okay. I'm right here. I've been trying to help her brush her teeth, but lately it's been almost impossible, and I need help with this because she's not brushing her teeth on her own, obviously, and I'm just really frustrated. I don't know what to do.
Oh, I know. This is so hard.
Yeah.
It's so hard whenever somebody has gotten to the point where it's very difficult for them to take care of themselves. My suggestion for Miss Mary, the way I want to treat her, is that I don't think we can do it here in the office because obviously she needs a little bit of help in relaxing.
Yeah.
So I would like to take her to an outpatient center that we work at. and I work with an oral surgeon
Okay.
there, and we can have the oral surgeon get those teeth out that are
Okay.
bothering her. They look like they're abscessed, and I think they need to come out. She's got some other teeth that have some small cavities in them, and I think those can be fixed. And she really needs to have her teeth cleaned. Her gums are infected, and there's pus coming out whenever I measure around them. So I think we can take care of all that in one
You sure?
appointment.
Because my grandmother, I mean, she had dentures and she never had problems with her teeth. I mean, do you ever just like pull their teeth? I mean, I don't mean to move too far ahead, but I mean, maybe just pulling her teeth out and giving her dentures, would that be better because she can't take care of herself?
Well, at this stage of the game, I think we can set it up in such a way. She still has enough teeth that are in good shape,
Okay.
but I think she's going to be able to function better.
Okay.
If we take out all her teeth now, I don't think that your mama is going to be able to adjust well to having dentures under these circumstances.
Okay.
I don't think we're quite to that point where we need to do that. I'll bet your grandma had her teeth taken out when she was much younger.
Yeah, I only knew her with dentures, so
Yes.
her whole life. I don't know when she got them. Probably,
So
yeah.
She had already adapted to using dentures,
Yeah.
but your mama's not to the point where she can do that at this time. And it's much better if we can keep as many teeth as possible.
Okay.
And I believe that there's some things that we can do that are easy that will help you learn how to take care of them and help her
Okay.
take care of them in every way that she can. And even once she gets to the point where she can't take care of them so well, there's some things that we can do. It'll help her continue to eat and chew
Yeah.
normally and stay on a more regular diet. If we take all her teeth out now, she's going to have to go on a really soft diet,
Oh,
and
okay.
nutritionally, it's not as good for her. It makes it a whole lot more of a challenge, and we don't want to change things any more than we have to for her.
And I don't want her to be in pain anymore. She just looks, makes me really sad to see her like this.
Me too.
Yeah.
I don't want you to be in pain either,
Yeah.
Miss Hamilton, and we're going to do everything we can to make you feel
hurts.
better. I know it
Okay,
hurts.
Mom.
We're going to help you. One of the things I need to do is talk to the physician's office and talk to the nurse practitioner and make sure that until we can get this all set up, that you've got some medicine to be able to take that will make it feel better.
Oh, good.
And
okay.
then, but I want to get to this as soon as we possibly can.
Okay.
Then after that, we'll get together with you and talk about how you can help her
Okay.
in order to take care of them. Does that sound like a good plan?
Yeah, thank you. I just want to relieve her pain, so the faster we can do that, the better I'll feel.
Absolutely. I
Okay.
agree.
Thank you.
Thank you so much for bringing her in so we can help you.
Thanks.
Dr. Furman has some concerns about the amount of medication Ms. Hamilton is taking. She has placed a call to the pharmacist for advice and assistance.
Hi, this is Dee Antimacieris.
Hi, Dr. Antimacieris. This is Dr. Furman with U of L, and I'm just returning your call. I got a message that you called about Miss Hamilton.
Oh, hi, Dr. Furman. Thank you for calling back. I'm the community pharmacist who did a MTM or medication management consult with Mrs. Hamilton and her family. And we found a couple of things that might be of interest to you in terms of over-the-counter and supplement use. Her main complaint and the family's main complaint is that she's becoming very forgetful. And we discovered that she's taking Tylenol PM every day and using Oxytrol patches for incontinence, for urinary incontinence. And both of those can cause memory impairment because they're strongly anticholinergic. We found that she's using ginkgo biloba, which has been known to cause platelet problems, bleeding, but not do anything to impact memory positively. And she's also taking memory vitamins.
Wow,
I just wanted you to know.
Yeah, I had no idea she was on these over-the-counter medicines, so I really appreciate this information.
Great, yeah, that's what we figured. A lot of times that doesn't make it into the chart. But so, in terms of her Oxytrol patches for urinary incontinence, we also noticed that she's taking a lot of water pills, including her Diovan HCT, which the hydrochlorothiazide is a water pill, and so is furosemide. So you might want to check out her need for that or lack of need for it, because without that, she might not need the Oxytrol patches at all.
I have her chart here, and we don't have that she has congestive heart failure. So I'm going to stop that hydrochlorothiazide and the Lasix, the furosemide, and just get rid of the water pills. And yeah, I don't think she'll need the Oxytrol. So that's a great recommendation. Thank you so much.
Because that would be a major improvement in terms of her cognition and her memory. It may not bring her back to normal, but it would certainly help optimize her function. to not use the Oxytrol. And as far as the Tylenol PM at night, I guess the question is, why is she needing it, and what else could be used?
Yes, I'll follow up with her about that. I didn't know she was taking it. If she needs something for sleep, we can use safer medicines like, Remeron or Trazodone or the melatonin. So yeah, we'll look at that.
Excellent. And lastly, I noticed that her simvastatin, or her cholesterol pill, is at a really high dose. It's 80 milligrams at bedtime. And sometimes that medication can cause memory impairment too, as well as muscle pain.
That's a good point. I didn't even know that the cholesterol medicines could do that until recently. So we'll check her lipids, and if she doesn't need it, we'll get it off. We'll get it off of it. But if she needs a medicine for cholesterol, what would you recommend?
Well, a safer one would be pravastatin or fluvastatin. And sometimes Crestor or rosuvastatin is safer for the brain. Pravastatin and fluvastatin are water-soluble, so they don't cross into the brain, whereas the rest of them can. And rosuvastatin or Crestor is semi-water-soluble. So simvastatin and atorvastatin are the most fat-soluble, and that's why they cross into the brain more than the others.
That's perfect. So yeah, we'll switch her over to Crestor or the pravastatin if she even needs it. So I'll check her lipid profile. Well, thank you so much, Dr. D. This was really, really helpful. I didn't know she was even on some of these medicines.
Okay, well, thanks for calling back, and call me if you need anything else.
All right, I will do. Thank you so much.
Okay.
Bye-bye.
Bye-bye.